This is Sam. He struggles to focus during class and follow instructions at home, forgets to hand in his homework, and has difficulties in self-control. During class, he always squirms in his seat and talks excessively. These symptoms are signs that Sam has ADHD. According to the DSM-5, ADHD is separated into two major symptom domains: inattention presentation and hyperactivity impulsivity presentation. Individuals with predominantly inattentive presentation have difficulty holding attention and do not seem to listen even when spoken to directly. Individuals with predominantly hyperactive impulsive presentation show an inability to sit still and often talk excessively. Some people, like Sam, have combined presentations of both domains. ADHD symptoms can be mild, moderate, or severe. Symptoms must also onset before the age of 12 and occur in 2 or more settings. There are other people like Sam with ADHD. In Hong Kong, ADHD affects about 6% of children, with around 2 boys to 1 girl being affected. Globally, ADHD prevalence in children aged 18 is around 7.2%, while the estimates of worldwide adult ADHD prevalence averaged 3.4%. So what are the risk factors of ADHD? They can be biological, neurological, and environmental. Studies reveal that the prefrontal cortex, caudate, and cerebellum are the primary areas exhibiting deficits in ADHD, which are responsible for regulating attention, emotions, behaviors, and thoughts. Another cause is the deficiency of neurotransmitters, especially epinephrine and dopamine. Lack of these molecules in the brain would lead to the breakdown of the brain reward cascade, in which the brain continuously craves stimulation, resulting in abnormal development of the specific brain areas and thus abnormal conduct seen in ADHD individuals. In addition to the above, the environment also plays a role in triggering ADHD. Fetal exposure to alcohol, maternal smoking during pregnancy and delivery complications, prematurity, and negative parenting styles are proven to increase the chance of developing ADHD to a certain extent. In short, the emergence and different outcomes of ADHD are the results of the interplay between biological, neurological, genetic, and environmental factors. ADHD can lead to impairments in Sam's daily life. Impairments in children with ADHD exist mainly in the form of cognitive and functional impairments. Cognitive impairments exist in the form of executive function deficits, such as working memory and inhibition. It affects children's development of self-control and self-regulation, and consequently higher-level functioning, like planning and decision-making. The most common functional impairments include academic impairments and social impairments. They have poorer academic achievement, and their symptoms, including inattention, difficulty in finishing tasks, and disruptive classroom behavior, all contribute to their academic difficulties. Social impairments can be classified by their inappropriate and socially awkward behavior, and their louder and more forceful actions could be perceived as aggressiveness, all of which combined with their emotional inflexibility and impatience can cause rejection by other children. So after assessment and diagnosis, what are the treatments for ADHD individuals? Unfortunately, there is no complete cure for ADHD. The goal of treatment is to improve core symptoms and restore functioning to minimize impairment to one's life. While treatment methods and combinations are on a case-by-case basis, a multimodal approach is most commonly used to treat ADHD patients and proved to be most effective. It involves the use of medications and behavior therapy. There are 2 types of medications: stimulants and non-stimulants. They reduce core symptoms by improving the efficiency of neurotransmission by increasing the release of neurotransmitters, or inhibiting reuptake, reducing hyperactivity and impulsivity while increasing attention, resulting in better information processing, which is proven effective in 70 to 80% of patients. However, side effects include growth restriction, weight loss, and many more. Thorough assessments are needed for choosing the right type and amount of medication. Medications are not recommended by the FDA for children under 6. More importantly, due to the nature of drugs and their side effects, medication should be used with caution, and behavior therapy should be implemented before considering medication. The goal of behavior therapy is to reduce negative behavior and replace it with positive ones, restoring impairments. Behavioral parent training and school-based behavioral management are coordinated, so children always face clear guidelines and consequences regarding their behavior. They have been proven to be the most effective non-pharmacological intervention to counteract the symptoms of ADHD and related behavior problems. Parents are taught to use positive reinforcement, consistent discipline management strategies, and other techniques to help kids control their behavior. At school, classroom management strategies like a reward system or daily report cards are used to discourage negative behaviors. Visual cues, clear and segmented instructions, alternative coursework, and activity arrangements and more are employed to aid ADHD students' learning. According to EDB guidelines, assessment accommodations like extra time allowance and promptings will also be provided if needed. In addition, executive function training like organizational skills and cognitive training can improve their working memory and impulse control to better academic performance, while social skills training through coaching, group role play, or other methods can improve their social behavior. It's important to know that there is no best treatment for ADHD, and treatment should be given based on individual needs and life demands. Even with effective treatment, about 80% of children with ADHD still experience it as an adult. Sam grows up into an adult, and ADHD continues to follow him. How will Sam be affected? Due to treatment, symptoms become more stable to adulthood, but symptoms may be presented differently. Major symptoms include meaningful low mental effort, disorganization, motor overactivity, and verbal impulsivity clusters, showing more differentiation. However, some symptoms, such as difficulty in sustaining attention and often easily distracted, are usually carried into adulthood. Treatment in adulthood continues to operate on a case-by-case basis, and a multimodal treatment approach is still adopted, while the continued use of medication depends on individual conditions. As they face new life demands, some therapies are specifically designed for adults, such as behavior coaching that teaches strategies for home organization or managing time and money. CBT can also be used to increase habits and skills needed for executive self-management, improve emotional and interpersonal self-regulation, and thus boost self-esteem and improve quality of life. Work support should also be provided by employers, including the use of visual print and headphones to reduce distractions and provide stretching breaks. Again, although there is no cure for ADHD, effective treatments allow patients to live with minimum impairment and disturbance. Many people like Sam suffer from the burden of ADHD and continue to face stigmatization. They face prejudice across school and work settings, which will lead to social rejection. They may also internalize the public stigma that they face into self-stigma, further lowering their self-esteem. To combat public stigma, public education is needed to increase a fuller understanding of ADHD and rectify any misconceptions. Promoting prenatal health is also important due to its significance in preventing ADHD. While primary prevention exists, there is still a lack of secondary prevention. There are only preliminary research proposals for secondary screening prevention in the United States. We hope that secondary prevention can be implemented in the future so that ADHD individuals can have positive outcomes and people like Sam can get all the help that they need. If you want to know more about ADHD, check out our fact sheet.